Welcome to the breastfeeding promotion and support in a baby-friendly hospital. Session 3: Promoting breastfeeding during pregnancy. Objectives for this session: outline what information needs to be discussed with pregnant women. Explain what kind of antenatal breast preparation women need for breastfeeding, what is effective and what is not effective. Identify women who need extra attention. Outline what information needs to be discussed with pregnant women who are HIV positive. Practice communication skills to use when discussing breastfeeding with a pregnant woman. Step 3: Inform all pregnant women of the benefits and management of breastfeeding. In many cultures, women assume that they will breastfeed. In other cultures, where breast milk substitutes are widely advertised and promoted, most women decide whether or not to breastfeed before their baby is born. It is important for health workers to educate women about breastfeeding as early as possible and to identify mothers and babies who may be at risk of breastfeeding difficulties. In order to make an informed decision about feeding, a woman needs information that is accurate and factual about the importance of breastfeeding and the risk of replacement feeding, not the health worker's personal opinion or marketing information from a formula company. Understanding of the information in her individual situation. This means giving information in words that are suitable for the women and discussing the information in the context of her situation. Confidence, which means building the woman's confidence in her ability to exclusively breastfeed. If she is not breastfeeding, she needs to be confident that she can find a replacement feeding method that is as safe as possible in her situation. Support to carry out her feeding decision. This includes support to successfully feed her baby and to overcome any difficulties. The woman needs to believe that she can carry out her decision. It is not enough for the health worker to think that she or he has provided sufficient information or support. The health worker needs to check with the woman that her information and support needs are met. Why is breastfeeding important? Breastfeeding is important to children, to mothers, and to families. Breastfeeding protects infants' health. Children who are not breastfed are more likely to be ill or to die from infections such as diarrhea, GI infections, and chest infections. Underweight and not grow well if they live in poor circumstances. Overweight and to have later heart problems if they live in rich circumstances. Breastfeeding is important to mothers. Women who do not breastfeed are more likely to develop anemia and to retain fat deposited during pregnancy, which may result in obesity, to become pregnant soon after the baby's birth, develop breast cancer, and have hip fractures in older age. In addition, breast milk is readily available. There's nothing to buy, and it needs no preparation or storage. Breastfeeding is simple, with no equipment or preparation needed. If a baby is not breastfed, the family will need to buy replacement milk for the baby and find some time to prepare feeds and keep feeding equipment clean. If a baby is not breastfed, there may be loss of income through a parent's absence from work to care for an ill child. Mother's milk is all a baby needs. Exclusive breastfeeding is strongly recommended for the first 6 months. The baby does not need water, other fluids, or foods during this time. Breastfeeding continues to be important after the first 6 months, when other foods are given to the baby. A mother's milk is especially suited for her own baby and changes from day to day, month to month, and feed to meet the baby's needs. The baby learns the taste of the family foods through the flavors of the breast milk. Mother's milk is unique. Human milk is a living fluid that actively protects against infection. Artificial formula provides no protection from infections. Practices that can help breastfeeding to go well. Hospital practices can help breastfeeding to go well. These practices include: have a companion with you during labor, which can help you to be more comfortable and in control. Avoid labor and birth interventions such as sedating, pain relief, and cesarean sections, unless medically necessary. Have skin-to-skin contact immediately after birth, which keeps the baby warm and gives an early start to breastfeeding. Keep the baby beside the mother, rooming in or bedding in, so that baby is easy to feed as well as safe. Learn feeding signs in your baby so that feeding is baby-led rather than a schedule. Feeding frequently, which helps to develop a good milk supply. Breastfeeding exclusive with no supplements, bottles, or artificial teats. It is important to learn how to position and attach the baby for feeding, and a member of staff will help after the baby is born. Most women can breastfeed and help is available if needed. Information on HIV testing. All pregnant women are offered voluntary, confidential HIV counseling and testing. If a woman is HIV infected, there is a risk of transmission to the baby during the pregnancy and birth, as well as during breastfeeding. If the pregnant woman knows that she is HIV positive, then she can make informed decisions. About 5 to 15% of babies, 1 in 20 to 1 in 7, born to a woman who are HIV infected will become HIV positive through breastfeeding. This means most infants born to a woman who are HIV positive will not be infected through breastfeeding. The risk of the child of illness and death from not exclusively breastfeeding is higher than the risk of HIV transmission from breastfeeding. One of the reasons that individual counseling is so important is that it gives mothers the information they need to make the informed choices about how to feed their babies in their own situations. The majority of women who are not infected with HIV, breastfeeding is recommended. For women who do not know their status, women who are HIV negative. Start the discussion with an open question. Begin with an open question such as, what do you know about breastfeeding? This type of open questions gives an opportunity to reinforce a decision to breastfeed, to discuss any barriers that the woman may see to breastfeeding, or to discuss problems the woman may have had with previous breastfeeding. Use your communication skills to continue the discussion. Let the pregnant woman discuss her individual worries and concerns about feeding her baby. It is important that the discussion is a two-way between the pregnant woman and the health worker, rather than a lecture to a woman. If the woman's comments tell you that she already knows much about early and exclusive breastfeeding, you can reflect and reinforce her knowledge. You do not need to give her information that she already knows. A woman's decision about how to feed her baby may be influenced by the baby's father, her own mother, or another family member. It can be helpful to ask, what people are these who are close to you who will support you to feed your baby? You may suggest that a family member who is important to the woman comes with her to hear more about feeding her baby. Antenatal discussion is an important part of care. An individual in this discussion on breastfeeding do not need to take a long time. A short, focused discussion for 3 minutes can achieve much. A pregnant woman may see different health workers during their antenatal care. All health workers have a role in promoting and supporting breastfeeding. Some hospitals use an antenatal checklist in the women's file to record discussion and highlight points to discuss further at another visit. Antenatal breast and nipple preparation. Reassure the mother that most women breastfeed with no problems. Other body parts, such as ears, nose, fingers, or teeth, come in various sizes and shapes, and no one asks if big ears hear better than small ears. Breasts and nipples can look different and still work perfectly well, except in a very rare cases. Antenatal practices such as wearing a bra, using creams, performing breast massage or nipple exercises, or wearing breast shells do not assist breastfeeding. Practices such as toughening of the nipples by rubbing with rough towel or putting alcohol on the nipples or excessive pulling are not necessary and may damage the skin and tiny muscles that support breastfeeding and should not be encouraged. Breast examination during pregnancy can be helpful if it is used to point out to a woman how her breasts are increasing in size, that there is more blood flow to them and changes in sensitivity, and how these are all signs that her body is getting ready to breastfeed. Check for any previous chest or breast surgery, trauma, or other problems, like lumps in the breast. Talk to mother about regular breast examination and why it can be helpful. Breast examination during pregnancy can be harmful if it is used to judge a woman's nipples or breast as suitable or unsuitable for breastfeeding. It is very rare for a woman to be unable to breastfeed due to the shape of the breast or nipples. The ideal antenatal preparation is to use the time to discuss the woman's knowledge, beliefs, feelings about her breastfeeding, and to build the woman's confidence in her ability to exclusively breastfeed her baby. Women who need extra attention. Identify women with special concerns. Help them to talk about issues that may affect their plans about feeding their baby. Offer to talk also to significant family members as needed so that they can support the woman. A woman may need special counseling and support if she had difficulties breastfeeding a previous baby and gave up and started formula feeding quickly or never started breastfeeding. Women must spend some time away from her baby because she works away from home or she's attending school. Assure her that she can breastfeed with separations. Has a family difficulty? Help her to identify non-supportive family members and try to meet with them to discuss their concerns. Women is depressed, isolated, without social support, young, single mother, has an intention to leave the baby for adoption, had previous breast surgery or trauma that could interfere with milk production, has a chronic illness or needs medication, at high risk of her baby needing special care after birth, or twin pregnancy is te- is tested and shown to be HIV positive. There is generally no need to stop breastfeeding an older baby during a succeeding pregnancy. If the woman has a history of premature labor or experiences uterine cramping during breastfeeding, she should discuss this with her doctor. Similar to our pregnant women, the mother who is breastfeeding and pregnant needs to take care of herself, which includes eating well and resting. Sometimes the breasts feel more tender or the milk seems to decrease in mid-trimester of the pregnancy, but these are not reasons of themselves to stop breastfeeding. Whether there is a shortage of food in the family or not, breast milk may be a major part of the young child's diet. If breastfeeding stops, the young child will be at risk, especially if there is no animal foods in the diet. Feeding the mother is the best efficient way of nourishing the mother, the unborn baby, and the young breastfeeding toddler. Abrupt cessation of breastfeeding should always be avoided. If a pregnant woman feels that exclusive breastfeeding is impossible for her to do, talk with her about why she feels exclusive breastfeeding is impossible. You can suggest that she start with exclusive breastfeeding. If it is too difficult in her situation to continue, then some breastfeeding is better than not breastfeeding at all. If a mother is not breastfeeding for a medical reason such as HIV or her informed personal decision, then it is important that she knows how to feed her baby. These women need individual discussion about replacement feeding and assistance to learn how to prepare feeds. Antenatal discussion with women who are HIV positive. Offer all pregnant women counseling and voluntary testing for HIV. Women who are tested and found to be HIV positive need extra care and attention during their pregnancies. In the situation where the woman is tested and found to be HIV positive, the recommendation regarding the infant feeding is when replacement feeding is acceptable, feasible, affordable, sustainable, and safe, avoidance of all breastfeeding by HIV-infected mothers is recommended. Otherwise, exclusive breastfeeding is recommended during the first months of life and should be then discontinued as soon as it is feasible. All HIV-positive women need counseling that includes information about the risks and benefits of various infant feeding options, guidance in selecting the most suitable option for their situation, support to carry out their choice. If after counseling, a woman who is HIV positive decides that her replacement feeding can be acceptable, feasible, affordable, sustainable, and safe, then she needs help to learn how to obtain, prepare, store, and feed it. She should learn before her baby is born so that she is ready to give her baby replacement feeds immediately after delivery. The woman who is HIV positive will also need to discuss avoidance of mixed feeding and care of her breasts until the milk is gone. If replacement feeding is not suitable, then the mother should not attempt it. Instead, she can consider safer breastfeeding, which means exclusive breastfeeding followed by safe transition to exclusive replacement feeding. A mother may decide to express her milk and heat it to kill the HIV. Some women may decide to breastfeed exclusively and to stop breastfeeding as soon as a replacement feeding method becomes acceptable, feasible, affordable, sustainable, and safe in her situation. If a mother who is HIV infected breastfeeds, exclusive breastfeeding is thought to reduce the risk of transmission by about half. Session 3 Summary. A pregnant woman needs to understand that breastfeeding is important for her baby and for herself. Exclusive breastfeeding for 6 months is recommended. Frequent breastfeeding continues to be important after complementary food is added. Early skin-to-skin contact, early initiation of breastfeeding, rooming in, frequent baby-led feeding, good positioning and attachment, and exclusive breastfeeding are beneficial. Support is available to, to the mother. Ideal antenatal preparation is that which builds the woman's confidence in her ability to breastfeed. Breast and nipple preparation are not needed and can be harmful. Some women will need extra attention if they had previous poor experiences of breastfeeding or at risk of difficulties. Offer all pregnant women voluntary and confidential HIV counseling and testing. A woman who is HIV positive needs individual counseling to help her to decide the best way to feed her baby that is acceptable, feasible, affordable, sustainable, and safe in her circumstances. The importance of breastfeeding and breast milk. Breastfeeding is important for the short and long-term health of children and women. Both the action of breastfeeding and the composition of breast milk are important. The action of breastfeeding helps the child's jaw to develop as well as muscles such as the tongue and muscles of the eustachian tube. This development reduces the incidence of ear infections, assists with clear speech, and protects against dental caries and reduces risk of orthodontic problems. Infants appear to be able to self-regulate their milk intake. This may have an effect on later appetite regulation and obesity. This appetite control does not appear to happen with bottle-fed milks, where the person feeding the baby controls the feed rather than the baby. Breastfeeding also provides warmth, closeness, and contact, which can help physical and emotional development of the child. Mothers who breastfed are less likely abandon or abuse their babies. Breast milk is important for children. Human milk provides ideal nutrition to meet the infant's needs for growth and development, protects against many infections, and may prevent some infant deaths. It reduces risk for allergies and of conditions such as juvenile onset diabetes in families with a history of these conditions. Programs body systems that may assist in blood pressure regulation and reduction of obesity risk in later life. Human milk is readily available, needing no preparation. A mother's own milk is best suited to the individual child, changing to meet the baby's changing needs. Many of the effects of breastfeeding are dose responsive. This means that longer and exclusive breastfeeding shows a greater benefit. Children who do not breastfeed or receive breast milk may be at increased risk of infections, such as diarrhea and gastrointestinal infections, respiratory infections, and UTI, eczema, and other atopic conditions. NEC, or necrotizing enterocolitis in preterm infants, lower developmental performance and educational achievement, thus reducing learning potential, developing juvenile onset insulin dependent diabetes mellitus, higher blood pressure and obesity in children, all markers of later heart disease, dying in infancy and early childhood. The dangers of not breastfeeding occur with all social and economic circumstances. Many studies indicate that a not breastfed child living in disease-ridden and unhygienic conditions is between 6 and 25 times more likely to die of diarrhea and 4 more times more likely to die of pneumonia than breastfed infants. This risk even lower with exclusive breastfeeding. If every baby were exclusively breastfed from birth to 6 months, an estimated 1.3 million additional lives would be saved worldwide and millions more lives enhanced every year. Breastfeeding is important for mothers, families, and communities. Compared to women who breastfed, not breastfeeding may increase the risk of breast cancer and some forms of ovarian cancer, hip fractures in older age, retention of fat deposited during pregnancy, which may result in later obesity, anemia due to low contraction of the uterus following birth, and early return of menses, frequent pregnancies due to lack of child spacing effect of breastfeeding, fewer opportunities to be close to the baby. Families are affected too. When a baby is not breastfed, there may be loss of income through a parent's absence from work to care for an ill child, higher family expenses to purchase and prepare artificial feeds, as well as extra time needed to give these feeds, and extra expense for the child's illnesses, worry about infant formula shortages or about an ill baby. Children who are not breastfed have increased illness, therefore increased use of health care services and increased health care costs, both as infants and later. In addition, healthy infants grow to become healthy, intelligent adults in the workforce, contributing to the well-being of their community. The risks from not breastfeeding are due to the lack of protective elements of breast milk, resulting in a higher illness rate, the lack of optimal balance of nutrients, for example, those needed for brain growth and intestinal development. In addition, there are the dangers from the use of breast milk substitutes themselves. These dangers may include infant formula may be contaminated through, through manufacturing error. Infant formula may contain unsafe ingredients or may lack vital ingredients. Water used for washing bottles or mixing infant formula may be contaminated. Errors in mixing formula, overconcentration or underconcentration. It may cause infant illness. Families may dilute the formula to make it last longer. Formula may be given to settle a crying baby, which can lead to overweight and food being seen as a solution to unhappiness. Water and teas may be given instead of breast milk or formula, resulting in a less milk consumed overall and low weight gain. Purchase of infant formula creates unnecessary expenses for the family and means less food for other members. Frequent pregnancies may burden the family and society. Hospital costs are higher for staff and supplies to treat health problems. How breast milk is unique. Breast milk has over 200 known constituents, as well as constituents that are not yet identified. Each animal has milk specific to the needs of that species. A mother's milk is especially suited for her own baby. It changes to provide nutrition suitable for the baby's needs. Colostrum and breast milk are adapted to gestational age, and mature breast milk changes from feed to feed, day to day, and month to month to meet the baby's needs. Breast milk is a living fluid that actively protects against infection. How breast milk protects? A child's immune system is not fully developed at birth and takes to age 3 or more to fully develop. Breast milk provides protection for the baby in a number of ways. When the mother is exposed to an infection, her body produces antibodies or infection-fighting substances to that particular infection. These antibodies are passed to the baby through her breast milk. Mother's milk stimulates the baby's own immune system. Factors in breast milk help the growth of the cell walls of the baby's gut, thus aiding the development of a barrier to microorganisms and allergens, as well as aiding the repair of damage from infections. White cells present in the breast milk are able to destroy bacteria. Components in breast milk also prevent the microorganisms from attaching the cell walls. If they do not attach, they pass out of baby's system. The growth of beneficial bacteria in the breastfed baby's system leaves little room for the growth of the harmful bacteria. Nutrients are not available for harmful bacteria to grow. For example, lactoferrin binds to iron preventing disease, causing bacteria from using this iron to multiply. Artificial formula contains no living cells, no antibodies, no live anti-infective factors, and cannot actively protect the baby from infections. What is breast milk? Colostrum is produced in the breast by 7th month of pregnancy and continues through the first few days after birth. In appearance, colostrum is thick, sticky, and clear to yellowish in color. Colostrum acts like a paint coating the baby's gut to protect it. If any water or artificial feeds are given, some of this paint can be removed, allowing infections to get into the baby's system. Colostrum is a baby's first immunization against many bacteria and viruses. Colostrum helps to establish good bacteria in the baby's gut. Colostrum is the perfect first food for babies, with more protein and vitamin A than mature breast milk. It is laxative and helps the baby to pass meconium, or the first sticky black stools. This helps to prevent jaundice. Colostrum comes in a very small amounts. This suits the baby's very small stomach and immature kidneys that cannot handle large volumes of fluid. Breastfed newborns should not be given water or glucose water unless medically necessary. Preterm breast milk. The milk of a mother giving birth before 37 weeks gestation, preterm breast milk, has more protein, higher levels of some minerals including iron, and more immune properties than mature milk, making it more suited for the needs of a premature baby. A mother's milk can even be used before the baby is able to breastfeed. The mother can express her milk and it can be fed to the baby with a cup, spoon, or tube. Mature breast milk contains all of the major nutrients: protein, carbohydrates, fat, vitamins, minerals, and water in the amounts that the baby needs. It changes in relation to the time of the day, the length of the breastfeed, the needs of the baby, and diseases with which the mother has had contact. The components of breast milk provide nutrients, as well as substances that help in digestion, growth, development, and provide protection from infections. Breast milk continues to provide these nutrients, protection, and other benefits as the child grows. These components do not disappear at a certain age. Nutrients in breast milk. The amount of protein in breast milk is perfect for infant growth and brain development. It is easy to digest and can quickly supply nutrients to the baby. Artificial formulas have different proteins from human milk that can be slow and difficult to digest, which can put a strain on the baby's system. Some babies can develop intolerance to the proteins in formula, resulting in rashes, diarrhea, and other symptoms. The level of protein in breast milk is not affected by the mother's food consumption. Fat is the main source of energy for the infant. Enzymes in breast milk start the digestion of fat so that it is available quickly to the baby as energy. Fat in breast milk contains very long-chain fatty acids for brain growth and eye development, as well as cholesterol and vitamins. The high level of cholesterol may help the infant to develop body systems to handle cholesterol throughout life. The level of fat is low in the milk at the beginning of a feed. This is called foremilk and quenches the baby's thirst. The level of fat is higher in the milk later in the feed. This is called hind milk and it gives satiety. Fat content can vary from feed to feed. Artificial formula does not change during the feed and lacks digestive enzymes. Artificial formulas have little or no cholesterol. Some brands may have fatty acids added. However, this may come from fish oils, egg fat, or vegetable sources. The type of fat in breast milk can be affected by the mother's diet. If a mother has a high level of polyunsaturated fats in her diet, her milk will be high in polyunsaturated fats. However, the total amount of fat in the milk is not affected by the mother's diet unless the mother is severely malnourished with no body fat stores. Lactose is the main carbohydrate in breast milk. It is made in the breast milk and is constant throughout the day. Lactose helps in calcium absorption, provides fuel for brain growth, and retards the growth of harmful organisms in the gut. It is digested slowly. Lactose in the breastfed baby's stool is not a sign of intolerance. Not all artificial formulas contain lactose. The effects of feeding healthy infants, breast milk substitutes without lactose are unknown. Exclusive breastfeeding for the first 6 months. Exclusive breastfeeding provides all the nutrients and water that the baby needs to grow and develop in the first 6 months. This means to the end of 6 completed months, 26 weeks or 180 days, not the start of the 6th month. Exclusive breastfeeding means that no drinks or foods other than breast milk are given to a baby. Vitamins, mineral supplements, or medicines can be given if needed. Most exclusively breastfed young infants feed at least 8 to 12 times in 24 hours, including night feeds. Any of the following interferes with exclusive breastfeeding. A baby is given any drinks or foods other than breast milk. A baby is given a pacifier, dummy, or soother. Limits are placed on the number of breastfeeds. Limits are placed on suckling time or the length of a breastfeed. After 6 months, children should receive complementary foods in addition to breast milk. Breast milk continues to be important, often providing one-third to one-half the calories for the child at 12 months of age. It should be continued after 2 years of age and beyond. Recommendations related to breastfeeding for women who are HIV positive. If a woman is HIV infected, there is a risk of transmission to the baby during pregnancy and birth, as well as during breastfeeding. About 5 to 15% of babies born to a woman who are HIV infected will become HIV positive through breastfeeding. To reduce the risk, mothers may choose to avoid breastfeeding altogether or to breastfeed exclusively and stop as soon as replacement feeding is feasible. In some settings, the risk of not exclusively breastfeeding is just as high or higher than the risk of HIV transmission from breastfeeding. This is part of the reason that individual counseling is so important. In the situation where the woman is tested and found to be HIV positive, the recommendation is when replacement feeding is acceptable, feasible, affordable, sustainable, and safe, avoidance of all breastfeeding by HIV-infected mothers is recommended. Otherwise, exclusive breastfeeding is recommended during the first months of life and should be then discontinued as soon as it is feasible. This recommendation does not say that all women who are HIV positive must avoid breastfeeding. A decision not to breastfeed has disadvantages, including increased risk to the infant's health. It is important to ensure that replacement feeding is acceptable, feasible, affordable, sustainable, and safe. Replacement feeding options, sources of milk, includes formula prepared from powder or sometimes concentrated liquid that needs only water to be added. Home-prepared formula made from animal milk with added sugar, water, and micronutrients. Commercial infant formula is made from animal milk. Formula from cow's milk may be processed to be high in whey proteins. This formula may be easier for the young infant to digest. The milk used as a base for home-prepared formula may be fresh milk that is heat-treated at home, commercially heat-treated whole milk, powdered full cream milk, or non-sweetened evaporated milk. The animal milks used may be from cows, buffalo, goat, camel, or other animals. In full-strength milk full cream formula, the level of protein and other minerals is too high, and it is difficult for an infant's immature kidney to excrete the extra waste. These milks require some modification to make the proportions more appropriate. It is important to remember that although the proportions of nutrients in either commercial or home-prepared formula can be altered, their equality cannot be made the same as breast milk. Also, the immune factors and growth factors present in breast milk are not present in animal formula or animal milk, and they cannot be added. Other types of formula are available and should only be discussed with mothers if the infant has a medical need for these specialized products. Soy infant formula uses processed soybeans as a source of protein and come in powdered form. Usually, it is lactose-free and has a different sugar added instead. Low birth weight or preterm infant formula, manufactured with higher levels of protein and certain minerals, and a different mixture of sugars and fats than ordinary formula for full-term infants. Specialized formula, available to use in conditions such as reflux, high energy and lactose intolerance, allergic conditions, and metabolic diseases like phenylketonuria. Follow-on or follow-up milks, marketed for older infants over 6 months old. They contain higher levels of protein and are less modified than infant formula. Products that are not suitable for making infant formula include skimmed milk, condensed milk, and creamers used for whitening tea or coffee.